was choosing where I wanted to go for residency, I kind of had this triple threat in my mind of people, program, and lifestyle, and Cincinnati met all those with flying colors.
When I got here, it was my last interview, and some of the other interns were like, "You're gonna love it here. This place is awesome." And by the time I was done with my interview, I was calling my husband saying, "We're going to Cincinnati because this is where I want to be."
I don't really think you could pick to be in a better place where you have the strength of the program combined with just how nice and caring everybody is here.
Traditionally, residents do their rotations, and then they have to go to conferences. But if you don't link the conferences to what they're learning, your brain doesn't fix information. So we have our morning reports, which are interesting ongoing cases that use adult learning theory, i.e. they're very short, 20-30 minutes burst in the morning. And then the noon conferences are general topics. The important thing is linking educational experiences to your clinical experiences is what is going to cement your knowledge, and that's how we do it in here.
For us to effectively take care of kids, they have to help take care of us. So giving us protected teaching time twice a day with a morning report and noon conference, providing breakfast and hot lunch at both of those was a fantastic perk, but really important for us to be able to be healthy, get nutrition, and be able to take care of the kids day in and day out.
You're getting taught all day long. Sometimes it's just something that an attending, when you're on rounds, will say, "Do you really want to have that pulse ox on that kid?" And then you have to stop and think about, well, why do I even really want that pulse ox and what am I trying to accomplish?
You do also need this half an hour of morning report or an hour of noon conference to not having to maybe like go to 1,000 different articles or 1,000 different books to get the information, but rather it coming from a person that knows a lot about the subject.
Here at Cincinnati Children's, we do family-centered rounding, which is a fantastic way to involve the family in the plan and care for their child. But every morning, our whole group comes in and we essentially tailor the presentation to the family. We direct it towards them. We use terms that families can understand, and we ask for their input all the time before we leave the room. The goal of that is to have the families, the nurses, and all of us on the same page before leaving, which really provides the best care for the child.
It's an art, it's a process in which you will learn how to talk to families and to interact with the team, how you can voice your opinions and how can you be taught by the bedside of the patient, and at the same time begin in your early stages of your career to start developing skills in how to communicating with families.
I've actually had a lot of fun. It's been great hanging out with my co-interns up in the resident lounge. We've hung out downtown at Findlay Market, gone to the Reds games, just going out and having dinner with people. I've actually had time to have a normal life.
I always said to my residents that the reason why I can have the passion, the energy, and the love for what I do is because I have a lot of fun.
Doing videos for the Olympics while on rounds, to having dance parties in the emergency room, to just spending time hanging out with the patients on the floor, talking to them, playing games with them, helping heal them more than just from the medical side.
We have residency council that meets once a month, and they get to talk about what's going on in the residency program. Things are changing all the time to make sure that our program is improving and not just staying stagnant.
This is a big place. There are a lot of residents, but the residents not only know each other really well, but really go to bat for each other and look out for one another. People who come to this program really want to be here, and that makes all the difference on a daily basis. I have co-residents who I look forward to seeing, who I look forward to working with, who I know there's going to be this aspect of teamwork that I haven't really experienced anywhere else.
This is a residency run by residents and for residents. We're very proud to say that most of our residents, when they decide to go into fellowship, they're chosen by the top fellowships in the country. And when they decide to go into primary care, they can actually handpick the practices they want to practice.
We have the benefit of having basically 3 or 4 hospitals squished into one enormous hospital, where we see everything from the primary care, pediatrics, all the way to the first degree referrals to see the subspecialists, to the tertiary quaternary care where no one else knows what's going on, and we're kind of the last hope for families.
We have children that are sent from all around the world. for complicated medical conditions that are seen here by multiple specialties.
Yes, you see subspecialties, but yes, you also get to do general peds rotations, you get to do clinic, you get to do ED. It's a very broad experience that we get.
There's no good subspecialist unless you become an excellent pediatrician. There's no good primary care provider unless you are the best pediatrician. So if there is something that I try to bring to our residency in here is that we will open the doors for you in any direction you want to go. But first we have to be 100% sure that we make you the best pediatrician out there.